Hi everyone, welcome back to my channel, and today I wanted to sort of pick up where we left off yesterday. I talking about volume or number of sets per exercise that is maybe produce the greatest changes or the best, maybe the most efficient way to strength train. And I wanted to really kind of add some content to that because after I thought about it a little bit more, look, this can be confusing, and it is very confusing for most fitness professionals. You have really a couple thoughts here. We've got people that believe in ultra low volume, taking each set to complete failure, and then you've got the really high volume proponents, or those individuals that promote high volume. And the whole purpose of yesterday was to talk about really how they both can be very effective, doing multiple sets, 4, 5, 6 sets per exercise, and maybe a greater than 10 sets per week per muscle group. And then also how lower volume, very low volume exercise can be effective as well. So maybe just doing one, 2, or 3 sets per muscle group or per exercise per week. But I wanted to really hit home with the main point here, and that is I usually start clients on a lower volume approach, okay? And that is simply because if they've been strength training, they've probably been doing way too much training volume in the first place. Like, for instance, I have clients that come to me that are spending 4, 5, 6 hours a week doing strength training. And that much training, regardless of how much total work you're doing, is not necessary, not needed for at all for most individuals at any point in their training career. So the first thing I do is cut their training time and volume down to 2 or at most 3 sessions a week of around 30 minutes or less. So by the nature of that sort of time prescription, they're doing much lower volume exercise. So that's the first thing we do, is we do go lower volume, anywhere from 1 probably to 3 sets per exercise, perhaps train the whole body 2 days per week. And again, and really try to build upon that limited volume framework so we can literally measure progression. Because if someone's doing 6 or 10 sets per muscle group, I really don't know how you're going to show progression at any point, other than the fact that progression can be just the volume itself or the amount of sets itself. So the point here is, when someone first begins with me, not always, we will start them on a lower volume approach, and then see how they tolerate that, and then perhaps increase the volume if needed. But if someone is improving, then there's really no reason to alter their training volumes. Now, there are times where people need to increase their training volume. So kind of like I talked about yesterday, really the most effective program may be the one that you're not doing. But I talked yesterday also about alternating maybe 4 weeks low volume, 4 weeks high volume, or 4 weeks low number of sets per muscle group, versus and then having 4 weeks of higher numbers of sets. That 4 week could be actually 6 weeks of each phase, or you could stretch it out to 8 weeks lower volume versus 8 weeks higher volume. There's just a number of variables there, but the main thing is being progressive with your training. So and that's where lower volume training, it becomes easier to be progressive. So for instance, if you were just doing for instance, one all-out set of pull-ups for each week, so you're doing one set where you do as many pull-ups as you can do with your body mass, and you did 10 the first week, and then the next week you did 12, right? That's pretty simple to focus on that one set and be progressive on those sets. So but we don't always start low volume, but most of the time we start with a lower volume. And my thought and my experience as training clients is that if someone's making progress doing a lower volume, then it's probably more efficient to do that than to add more volume. Because the fact of the matter is, even if they do add a whole lot more volume, their results may not be any better, or the amount of time or stress on the body may not be reflective in the outcome that we get. So if someone's getting great results training at a somewhat lower volume approach, then really why change it? But when volume starts to stale, or progress starts to stale or stall, the person becomes like, yeah, it's time to do something different, right? They're part of their their makeup. It's time to change something different. We could add more volume. So alternating high volume and lower volume periods is a good strategy, but I do think a lower set total approach, if it is effective for the individual, they are getting stronger and improving, especially during those early weeks and even few years of training, that may be the most efficient way for them to train. So the verdict is still, I don't think we've discovered optimal set totals per week, and we certainly haven't discovered it over a lifetime, right? I mean, training studies last 4 weeks, 8 weeks, 12 weeks. Very few extend farther than 12 weeks. So until someone does a study, maybe 2 groups of people where we have ultra low volume and ultra high volume, and we compare the results of each group, and each group stayed on the intervention a year, and then you measure their changes, so you could compare and contrast, whether a long-term approach to either lower volume or higher volume is more effective. And then you could actually do a crossover design where then in the next year, the group that did lower volume did high volume, and the group that did high volume does lower volume, and then you could actually perhaps come to some sort of conclusion. But then we do have some competing concerns with the order of when they did what. So but much work is left to be done in the area of research. So you do need to be careful when someone talks about the research says this or that. I think within reason, all of the volume approaches, low set totals versus very high set totals, I think they're both effective, and especially in novice trainees. But a lot of times doing more exercise is just more exercise. So I hope that helps. I hope that's clear. I'm not going to take a stand. All right. A lot of people ask me, and we as human beings, we want an answer, right? And in this particular case, there's no specific answer other than if you've been doing approach lower volume or higher for a period of time, it's time. And I mean, you completely have, kind of stalled, you're not improving, or, it may just be time to change and shift gears into the number of sets per muscle group per week. So anyway, it's really important to get good help, because a good fitness professional really kind of looks at all of the strategies and tries to figure out how to integrate them into your needs, your time, your goals, because really the most important factor is making sure the training program is realistic from a time commitment, how many days per week, outside stressors, and that kind of thing. So that's it for this week, or this video. If you have questions, feel free to put comments below. I'll do my best to answer them. Talk to you soon.